everyone. Thank you for joining Family Caregiver Alliance for our webinar on What is Aging Doing to My Body and What Can I Do to Stop It, presented by Lady Markham. This webinar is open to caregivers and professionals. CEUs are available through the Board of Behavioral Sciences. In order to obtain your continuing education credit, please email me at adugai@caregiver.org with your name and license number or other ID number. I am AJ Dugai, the Education Coordinator for Family Caregiver Alliance. Let me give you a little background on our organization. For over 35 years, we've been working through the Bay Area and across the nation to improve the well-being of family caregivers that are providing long-term care. We offer support through educational classes, workshops, fact sheets, retreats, caregiver support services, research, caregiver advocacy, and more. For more information, please visit us at www.caregiver.org. For the duration of your presentation, your phones will be muted. If you have any questions, you may ask them throughout by going to the GoToWebinar question box on your screen. These questions will be answered at the end of the presentation. After the completion of this webinar, you will be directed to a survey. Your feedback is very important to us in shaping our future education programs, so we would like to thank you in advance for filling those out. Today's speaker is Lady Markham. Lady Markham holds a degree in hospitality, gerontology, and nursing, making her a very knowledgeable and compassionate caregiver. Miss Markham has worked in long-term care communities for over 10 years and home care for 3 years. Miss Markham was Director of Food Services in a high-end San Francisco community. She transitioned to marketing and then was promoted to office manager of a large CCRC in Oakland. While working, she pursued her master's in gerontology and completed her training as administrator for skilled nursing. Next, she completed an accelerated Bachelor of Nursing degree. Further, working in assisted living communities as Health Services Director gave her an excellent base of knowledge in working with hundreds of older adults. As a registered nurse, Miss Markham is rewarded every day by being a mentor and teacher to a staff who provides holistic and practical care to its clients. Without further ado, I'll now turn things over to Lady.
Thank you, AJ. Very happy to be here. Welcome to our webinar on the physiological changes of aging. What is the normal process of normal aging? We look at the effects aging has on the body to find the answer. Along the way, we might find ways to slow or even improve our abilities to accept the changes. Our objectives today are to inform you of the 11 body systems. Yes, there's 11 of them. Some we'll just glance over and some we will blend together. Each system connects to certain diseases and conditions. We will explore the most common age-related ones. And lastly, we'll identify suggestions to living a healthier life that promotes a healthy aging. Getting older is not a choice, right? Our bodies defy our personal desires from the moment of conception. It's not always choice, but how we choose to live with our individual conditions. Please keep in mind throughout this session what you are personally doing and what influences you in your quest for healthy aging. Currently, we are making great strides in health services and cell regeneration, which in turn has increased human longevity. You would think, since our life expectancy has increased, that our dependency would decrease. After all, we all know that old 90-year-old woman who's still playing bridge and driving. But the reality is that the physiological changes are on the rise for older adults. There's decline in the body systems and a pervasiveness of developing diseases. Because we are living longer, our bodies are succumbing to disease later in life. Chronic conditions that once would have killed us at an earlier age are less of a factor, such as diabetes and renal failure. One of our most common disorders for older adults are sleep disturbances. I just want to touch upon this here because sleep disturbances affect over 50% of older adults living at home and over 70% of those living in long-term care facilities. These are usually because of environmental factors like noise, light, even nursing care. If you've ever been in the hospital, you know what I mean. There are many physical chronic conditions that can disrupt sleep, including angina, asthma, prostate hypertrophy, pain, GERD, that reflux, heart failure, migraines, etc., as well as emotional causes such as worry, anxiety, stress, depression, and grief. The most common sleep disorders are sleep apnea. That's when you forget to breathe. And restless leg syndrome. How can we help? Well, there's habits that we can use to improve the quality and quantity of sleep. So, follow a regular bedtime and wake-up schedule. If you're going to exercise, and I hope you do, exercise in the morning and do quiet hobbies and activities at night. Avoid napping during the day. Avoid watching TV in bed at night. Try and stay away from those over-the-counter medicines like those nighttime Tylenols and so forth. Stay away from caffeine or chocolate after 4 p.m. And both smoking and alcohol can also disrupt your sleep. The best things to do is keep the bedroom quiet, dark, cool, and with a good mattress and bedding. You might even try taking a warm bath at night or listening to quiet music. And most important, if you do go to bed and not able to sleep after 15 minutes, get up and do not go to bed until you are sleepy. That can help. To begin, the biology around aging is complex and requires a PhD in physiology. I'm sorry, but I don't really qualify to get into this area of DNA, genes, and molecules. What I can say is each individual's molecular makeup relates differently, and their environment can be a factor in aging. I want you to first know how we regenerate or heal. In other words, how our bodies are able to replenish certain cells to heal continuously. This is important in our healing process because it's our capacity to regenerate that may define our uniqueness. For instance, as an Asian woman almost half a century old, I have few gray hairs and no wrinkles. Yet my Caucasian best friend since childhood is half gray and has character lines, that's what we call them, around her eyes, mouth, and lips. We're the same age, but unique to race and genes. There are 3 categories of cell replication. There's continuous replication due to challenge and non-replicating. Continuous replication are cells like our skin cells, our gastrointestinal or blood cells. The liver is a prime example of replication due to challenge from damage from alcohol or injury. And there are some areas that never regenerate or generate very, very slowly. The heart, brain, and bone cells. We will explore how we need to protect those areas that don't regenerate, as they are precious and often the cause of permanent deficits to the body. Our bodies are made of 11 physiological systems listed here. The largest system is the integument, or as you know it, as your skin. The surface of our skin is a marvel. It protects us and is capable of regeneration from cuts and burns, but over time it loses its elasticity and moisture. The lack of moisture lends itself to thinning, sagging, and wrinkles. It's easier to injure and slower to heal. Common physical changes that may appear are wisdom spots. These are those dark, discolored age spots. Deposits of fatty tissue, also known as skin tags, and a slackness in the skin around the face and body. It's important to get an annual full body scan by a dermatologist to assess for abnormalities. A small sample biopsy may be taken to screen for abnormal cells at times. It is good to rule out skin cancer. What can you do to protect yourself? Try to avoid direct sunlight exposure. Avoid smoking. Avoid excess heat and overuse of soaps and chemicals. Always wear your sunscreen, moisturize your skin, and if you are immobilized, be sure to be turned every 2 hours and kept clean and dry to prevent pressure ulcers. The musculoskeletal is a blend of bone structure and muscles that hold it all together. Movement and posture makes it possible to walk, bend, sit, and stand. Age can become a factor as joints wear down with use. Arthritis sets in and becomes painful, and muscle mass diminishes after being a couch potato. This time, the old adage, use it or lose it, does apply. The movement of the body enables it to regenerate the cells it can. It is the primary source of metabolic heat. Movement increases circulation, it aids in our digestion, it helps our mood, our balance, and our well-being. Muscles do lose size, elasticity, and strength over time. Incorporating exercise daily is important. If the joints are impacted, such as the knees or hips, then a replacement may be possible. These are invasive surgeries which need commitment by the patient to endure the rehabilitation. Commonly, older adults suffer from back and joint pain. They may also have bursitis, which are those small fluid-filled sacs around joints, sometimes caused by gout, overuse, and infection. Some people have fibromyalgia, which is pain in multiple areas. So what can be done? Well, relief can be had using moist heat, pain relievers, cold packs, or massage can sometimes help. To bear the load are our feet. We need to pay attention to them. Foot care is so important. After so many years of use, our feet can have poor circulation. They can have neuropathies, which is limited feeling. Ill-fitting shoes can cause a real problem. So can ingrown toenails, bunions, corns, plantar fasciitis, and fungal infections. What should you do? Visit a podiatrist about every 4 months to have your feet inspected and the toenails cared for, and etc. If you do have diabetes, though, a daily inspection is imperative in looking for cuts or bruises. Have the nails filed if not being taken care of by a professional. Exercise for the musculoskeletal is important in promoting healthy aging. There's 4 types of exercise, and each are recommended. Endurance exercises help with breathing and building up stamina and energy. Strengthening exercises makes muscles stronger. When the muscles are strong, then the bones they support are strong. Balance exercises help to prevent falls and injury. And strengthening exercises help maintain flexibility. What can you do if you've had a recent fall and are afraid of getting up alone? No problem. Take some time each day to stretch and move while in bed or in a chair. There is no fear of falling when you're sitting or lying down. You will benefit by concentrating on doing isometrics. That's clenching and releasing each body part. Try it. Lay down, start with your toes, and work your way up to your head. It's very relaxing and a great way of conditioning yourself. Next, try raising your knees to your stomach. If this is a challenge, use your hands. Try moving your arms above your head and to each side. What I'm really getting at is any movement is good. But for best results, consult your doctor or physical therapist for a tailored workout. I want you to move safely. What can you do is get an annual bone density test and consult your primary care provider to see if you should be taking supplements. The digestive system is one big long tube from the mouth to the anus. Simply put, it goes in one end, comes out the other. Digestion begins with the saliva glands in our mouth. Slow production of saliva make it more difficult to chew and swallow. Chewing well and drinking between bites will help. Good dental care for older adults is important. Often missing teeth, pain, and inability to chew can inhibit good nutrition. Get to see a dentist at least twice a year for a checkup and cleaning. You can also always sit at an angle of 45 degrees or higher when eating. This also limits the possibility of aspiration of food into the lungs. Remain seated upright for up to an hour after eating to aid in the digestion process and help if reflux is an issue. If constipation is a problem, this may be caused by the colon slowing in its function. Constipation is painful and can prevent older adults from participating in activities. Treatment is individualized. No one's the same. Many older adults believe a daily bowel movement is necessary, and this can often lead to laxative misuse. I'd like you to answer a couple of questions for us, for yourself, to determine if you are suffering from constipation. If you answer yes or to one or two or to at least two of these questions, then you should be talking to your primary care provider. 1. Do you have fewer than 3 bowel movements a week? 2. Do you have a hard time passing stool and straining? 3. Do you have pain while passing stool? 4. Do you have other problems such as bleeding while passing stool? So life changes are a good way to start in helping constipation. Drink more liquids, eat a high-fiber diet. Being upright and moving also helps the colon do its work. Use laxatives only if prescribed by your primary care physician. Identifying what foods are triggers for your poor digestion can also help. Understand what causes discomfort and have the good sense to avoid them if possible. What can you do is be screened for colon cancer by taking an occult fecal test to test for blood, and if necessary, a colonoscopy will be performed. Our cardiovascular system, which is our heart and it's our life pump, the main engine, as it were. Remember we mentioned earlier the regeneration of cells? Well, the cells in the are not able to regenerate. Aging decreases the heart rate, and the diastolic and end systolic volumes increase. That's both of those numbers and when you have your blood pressure taken. The interesting fact is that older bodies adjust to accommodate for challenges like exercise. The heart will use what they call the Frank-Starling mechanism, which is the ability to change to a more forceful contraction or volume when needed to produce enough energy to sustain the rest of the body. If the body is challenged with a poor diet and a sedentary lifestyle, over time it may develop dysfunctions. Certain dysfunctions can lead to congestive heart failure. There's two kinds, the left and the right. The left is when the left ventricle is not able to contract and push the blood out into circulation. Or also what can happen is that the left can be unable to relax so it can properly fill. The right side, congestive heart failure, is when the heart is not able to push blood into the lungs to get it reoxygenated. Arrhythmias are changes in the normal sequence of the rate and rhythm of the heart. There's three different kinds. There's atrial fibrillation, which is when the heart quivers and just can't find the right rhythm. There's bradycardia, which when it's too slow, and tachycardia when it's too fast. Many of us are also suffering from atherosclerosis, which is the clogging of the arteries. It is common age-related cardiovascular procedures are the use of pacemakers to aid with slow heartbeats. You can be taking medication for atrial fibrillation, and angioplasty is what they use to insert stents to open up the clogged arteries. Please educate yourself on the signs and symptoms of a heart attack. They are different for both men and women. Get your blood pressure checked regularly and eat well and exercise. The reproductive system for women of a certain age is no longer an issue, but for men, they have no limit to their ability to reproduce. It's healthy and natural to continue with a sex life well into a person's 90s. A woman can be made more comfortable with the use of a progesterone or estrogen cream for vaginal dryness, and a man can be helped with Viagra or the like for erectile dysfunction. An important point is that sexually transmitted diseases such as syphilis and chlamydia have seen a 50% increase in the past years, especially in areas with high populations of older adults. The use of condoms may not be necessary for contraception, but is useful for preventing sexually transmitted diseases. This message may have skipped the free love generation of the 60s, because those who were then in their 20s are now in their 70s and still might have the same mindset. What you can do is, for women, continue to do your monthly breast exams, and for men, have an annual prostate exam for cancer screening. The pulmonary system is all about the lungs, and is one area that ages very minutely for most people who have not suffered from any conditions like asthma or emphysema, or have smoked. Over time, the elasticity of the alveoli reduce and the small airways shrink. The capacity is reduced, affecting the ability to efficiently exchange air. Lung cancer is one of the leading causes of leading cancers. It's because the lungs are two spongy organs that are susceptible to carcinogens. It is a very aggressive disease that requires aggressive treatment. Those 65 or older may also see regular breathing while seated to be affected because a portion of the airway is not fully opening. And when lying down for long periods, fluids can build up and pneumonia could occur. If you do find yourself in bed for a long time, make a point of doing deep breathing every hour to help with lung expansion and reduce buildup of residual air. Try to blow out for 10 to 20 seconds to help recondition the lungs. And when breathing, you might even try placing your hand on your stomach and feeling it move in and out. Lymphatic and circulatory systems become the highways of the body for fluids and electrolytes. As a major system, which an older adult can quickly succumb to imbalances, circulating throughout our body, and every organ throughout our body and every organ are regulating minerals and elements. Like a sponge, the body must soak up and then release the used solution with the impurities. Here are some of the more common issues an older adult faces. Sodium deficiency occurs frequently because the body is not able to balance itself fast enough. The kidneys are not able to filter quickly, and a load is put upon the system. This is notable by those who are unable to excrete an elevated salt load, and volume is retained in the lower extremities, as edema, when your ankles swell. Until the balance is restored, then other measures need to be used. We might have to elevate the feet and try and do this at least an hour at a time. You might be using prescription diuretics like furosemide. Massage is also very helpful, and so are compression stockings. What you put into your body influences how your body processes the nutrients. Knowing what your body needs and providing the correct amounts can contribute to healthy aging. What is considered a well-balanced diet for an adult? Well, a good variety of food is nice. Try for foods that are low in cholesterol, high in fiber, and use monosaturated fats. Try to eat 5 fruits and vegetables per day, 3 servings of dairy, 3 servings of grains or breads, and only 6 ounces of proteins. Highly processed foods have empty calories and saturated fats. Not a well-balanced meal, which should be eaten in moderation. And when I talk about that, it's mostly frozen foods, like frozen dinners. If we can keep those to a minimum, that would be good. Dehydration is also one of the most common problems for older adults and can be exacerbated if older adults are experiencing edema or pain, or that they have a mobility issue that makes it hard to get up and void. Many people try to avoid drinking just so they don't have to get up and urinate. You know who you are. Fluid intake can also be influenced because of the degrees of the thirst mechanism. When the body is forced into a state of water conservation and urine concentration because it's not getting enough fluids, it can reduce the kidney function and retain impurities. Not flushing the renal system can lead to urinary tract infections, bladder infections, and even an altered cognitive state. On the flip side is water intoxication. And I really want you to be aware of this. Too much of a good thing can cause a rapid depletion of the much needed electrolytes. But everybody is different, and the old adage of 1 8-ounce glass per hour may be too much for some people. So ask yourself, how often are you urinating per day. We should try to go at least 6 or more times per day. Unless you're any less, then you're probably not drinking enough to properly flush your system. But do take into account if you are on a diuretic or have an enlarged prostate. You might be going more often and should be drinking more to replenish. The use of some beverages may be acceptable at times. You should talk to your primary care provider or nutritionist to see if you should be supplementing yourself with Ensure, Pedialyte, or even Gatorade. Hypokalemia, which is high potassium levels, is an increased risk for older adults as a buildup of potassium because the kidneys are not able to filter and excrete quickly enough. Too much potassium can alter your heart rate and rhythm, and this can be very dangerous. What can you do? Get an annual checkup, and your primary care provider will get results from complete blood panels to look at those levels. Vision and hearing deficits can contribute to acute incidents. Yeah, really, not being able to see the electrical cord that can be tripped over or hearing the ambulance while driving can put older adults in harm's way. Older adults can sometimes neglect and accept changes to their vision and hearing because they may isolate and they don't really realize the deficits. The changes in a person's sight can be changes in the retina, the refractive power, and the reduction of tear secretion, like dry eye. Your annual checkups can ensure that irritation and discomfort is lessened, as is the danger of hurting the corneal surface. There are complaints and diseases that can be checked for. Report problems like floaters. Those are the small white dots that you see and that can't be removed from your sight when you're blinking or through eye movement. You might end up with conjunctivitis, which is the inflammation around the eyes and cornea. There's glaucoma and macular degeneration that you can be diagnosed with. Cataract surgery, though, is one of the most common and successfully performed procedures in the world, and it's life-changing for many. So if you do need to get that, that's something you should put on your list. Hearing loss is not only about volume, but it's also about tones. Men especially lose the ability to hear high frequencies, which impedes their ability to not only hear, but to understand speech. Hearing loss is connected with prolonged loud noises. So, although we can't go back in time and turn down those speakers, we can get our hearing checked. And if there is hearing loss, it may be time to lose the vanity and get hearing aids if they're proven to help. Be sure to use a reputable vendor who guarantees satisfaction or your money back when you're going to your audiologist. When communicating with somebody with hearing loss, try to do so in a quiet environment. Have their attention, speak directly to them, and make sure that they can see your mouth. Use body language, but don't shout at them. And it's okay to repeat or rephrase to ensure that they understand. Be patient and don't show if you're upset or annoyed when trying to communicate. The endocrine system regulates the body's metabolism. When you are run down, tired, and low energy, your primary care provider will start looking at your endocrine levels first. The thyroid and pancreas are the usual suspects for an older adult. Commonly, the body becomes glucose intolerant, not able to properly make its own insulin in the pancreas, or maybe unable to recognize how to use the insulin, which can cause some older adults to develop type 2 diabetes. The older body may not be able to metabolize carbohydrates efficiently anymore. Obesity, physical activity, and diet influence how the body burns carbs. But if you notice yourself getting sweaty and feeling very hungry and thirsty often, you might be experiencing hypo or low blood sugar, or hyperglycemia, which is high blood sugar. See your primary care physician. A normal fasting blood sugar is between 70 and 110. This can run higher for some people, and being on certain medications can also influence those numbers. The thyroid gland, which is in your throat, reduces the amount of hormone it produces as we age. Many older adults are deficit and use synthetic thyroxine. If you're having problems with sleep disturbances or heart palpitations, please see and get your. It's just a simple blood test, and they can test to make sure that all those levels are correct. Women endure the biggest change with menopause, with the decrease of estrogen during menopause. The loss of estrogen strips most women of the protection of keeping the bone metabolism in check. The development of osteoporosis does become a risk factor. But an interesting case in point is that after menopause, a woman's LDL bad cholesterol levels rise and exceed a man's in postmenopause. Some believe this factor is the hypothesis of the sex difference in longevity, because the LDL to HDL ratios are better in women, and that is also a measure of the plaque in the heart. Neurological systems include the nervous system and the brain. This system is the command center for the entire body. It holds many mysteries to why aging decreases some people's abilities and not others. Senses are driven by neurons communicating. Over time, there are less neurons, and senses become dulled. The neurological system controls mood, and depression can result from impaired synaptic activity. Depression is not a normal part of aging, but it does need the older adult to participate in avoiding it and recognizing it. If you or someone you know is feeling blue, take a moment to look at the factors to see if depression is the reason. Check to see if any of the medications being taken have side effects of depression. Think about if there's any chronic illness, any sensory impairment. Hearing losses can be very, very isolating. Actually, my stepfather says that when his hearing went away, that he lost half the world. And pain can also be a factor in depression. Psychological conditions such as financial or familial worries are also factors to depression. It's important to seek treatment, get support, socialize, and be with people. You may even try some medication, but above all, be patient and kind to yourself. Common age-related conditions concerning the neurological system are ALS, which is a progressive neurodegenerative disease that causes muscle weakness, paralysis, and respiratory failure. Others include multiple sclerosis, which is an unpredictable disease of the central nervous system that disrupts the information going from the brain to the rest of the body and back. Stroke, that's when a portion of the brain is deprived of blood. Dementia and Alzheimer's, which are progressive disorders that affect the ability to remember and function. And Parkinson's disease, which is progressive disorders of the central nervous system that affects movement. Very little is known for the cause of each of these life-changing illnesses. Our best defense is awareness and education. There aren't cures for these conditions, but medications to address some of their symptoms. Stroke is one area with a regimented therapy that can make a difference, but it really depends on the extent of the damage the stroke has had on the individual. So learn the signs of stroke. There's an acronym called FAST, which is FAST. F is for facial droop. A is for arm weakness or numbness. S is for speech impairment. And T is for time. One of the things that you can do is, if you start to see these signs in yourself or anybody else, write down the time in which that starts and call 911. Tell the people what time you first saw these signs, and they'll be able to better titrate the medication, the clot-busting medication. If they don't have that time, then they probably won't give you the medication, and that can make the stroke worse. If you or a loved one does suffer from one of the countless neurological disorders I've just spoken of, and there are many more, please research and contact associations affiliated with them for more help. Each of these systems rely upon each other to properly support the entire body. Treating the body with the right foods, exercise, and rest is a great start. There will always be challenges. Facing them with an open mind and willfulness to get the most out of life is up to you. Thank you, and I'll take any questions if you like for the remaining time.
Thank you, lady. That was some very helpful information. And we thank you for taking the time to share with us today. So we do have a few questions that were sent in from our listeners. The first one reads, how does stress affect the aging process?
Good question. Chronic stress can affect all of us. But, UCSF has found that stress can affect us right down to the cellular level. Just the anticipation of stress can leave us open to accelerated aging. Women who are caregivers are usually the ones that are most affected with worrying. You should try to disengage if you can. Find yourself an activity that kind of pulls you away from that stressful situation, and so you don't keep dwelling on it.
Okay, thank you. And the next question I have is, if you start to eat healthier and exercise late in life, could this be beneficial, and can it reverse the aging process?
Well, I might not go so far to say it reverses the aging process, but you can't. It's never too late to start eating well and exercising. Everybody will see benefits if you choose a healthier lifestyle.
Okay. And is any system more important to take care of than the other?
Well, hard to identify which one is in particular the most important. But when we go back to the cell regeneration, I think looking at the ones that have been that don't regenerate and protecting those would be the most important ones, like the heart, the brain, and the bones.
Okay, thank you. And then our next question is, should an elderly person avoid alcohol?
That's a good one. Can I tell you a story? The oldest person I've ever known was 104 years old. When I was working in skilled nursing, my job was part of my job was to keep people hydrated, and so I would go around pushing this cart with juices and waters, and every time I asked this person if she'd want some water or juice, she'd always reply, "Got anything stronger?" The best part is that her son actually sent a bottle of scotch every month, and she had a drink every single day. We even had a prescription from her doctor to let her have it. But with everything, use it in moderation.
Okay, thank you. And our next question is, can you talk a little bit about reducing a fall risk?
Well, sure. I was just at one of my clients' homes, and brand new client, lots and lots of little carpets all over the place. And so you do want to try and make sure that your paths are clear, that you've got that you've got easy access to your canes or walkers. You'll notice that when people start to leave little hand trails along the wall, it's time for an assistive device. But as long as you're keeping things open and clear and flat, I think you're pretty good. Also, cords are very bad. You want to keep those out of the way as well.
Okay, thank you for touching on that. Our next question is, does aging affect men and women differently?
Well, women just seem to last longer, don't they? But they say that most men are, it really kind of has a lot to do with lifestyle. Women are more apt to get to their primary care provider more often and learn of what their needs are, and also be able to take the initiative in a healthier lifestyle. Men are not usually able to do that.
I see. Okay, thank you. And our next question is, should I bother getting vaccinations?
Oh, great question. Yes, there are some serious diseases that can be so simply prevented with a vaccine. I would really consider the big three, which are annually get a flu shot. I know it's not 100% preventative because there's so many strains, and this year is a good example of that. But over the years, it's been very effective, and older adults are really at risk for that.
Okay, thanks.
As well, you should probably get a pneumonia shot, or they call it a pneumococcal. That is a serious infection of the lungs that people older than 65 only have to get one dose. But if you've ever had the pneumococcal vaccine before you're 65, you should be given one 5 years after you've reached 65, to like a booster. And there's one more that you should probably consider, which is shingles. It's a very long and painful condition that runs along your nerves. And that's only a single dose when you're around 60.
Okay, that's helpful. Thank you. And then our next question is, do you recommend SPF sunscreen and vitamins for skin protection, as well as what lotion for dry skin?
Oh, great question. I think that I would have to say Eucerin and Aquaphor are wonderful conditioners or moisturizers. And supplements, boy, that's a hard one. That really has to go down to your primary care provider. Women should be taking calcium with vitamin D. There's a whole bunch of reports on how vitamin D and is wonderful in protecting ourselves from Alzheimer's and all those antioxidants that we could get out there is also helping protect the myelin for against dementia and so forth. So there's so many things out there. I'm not quite sure if I answered that fully, though.
Yeah, I think that's a good explanation for their question. So the next one I have is it normal to have so many UTIs?
Urinary tract infections. That's not a good thing to have. No, but it could be that you may not be drinking enough to flush your system. Some of the things that happen is that people just don't want to get up, as I mentioned in the webinar. Try not to postpone going to the bathroom. Get up and go. Also, if you're having leakage, be aware of cleanliness. It's so important to be disposing of those pads and changing them frequently. Even, always, at least daily. Don't try to reuse them, as bacteria can remain on the pads or pull-ups. And one of the things I think is one of the best inventions ever is out of Japan, besides our those baby wipes, is getting yourself a washlet. It's like a bidet in the toilet seat, and so if you are incontinent, this is just a good way of keeping clean.
Okay, thank you, lady. And the last question I have sent in is, can seniors benefit / is it safe for them to do yoga?
Oh, yoga is a wonderful thing for older adults. The stretching and improved flexibility can also increase circulation. You'll be toning your muscles, strengthening your bones and joints, not to mention the benefit from the breathing and the meditation for the mind. That's great.
Yeah, I'm sure that it would be helpful at any age. Okay, so that is all the time we have for questions today. Please feel free to call us or email us any additional questions that were not covered. Thank you for everyone who participated in What is Aging Doing to My Body and What Can I Do to Stop It? Presented by Lady Markham. Again, you will receive a survey after you exit the webinar, and we would really appreciate your feedback to shape our future programs. And thank you to Lady for joining us today.
Thank you.
And next month's webinar is titled The Mindful Caregiver, Why Self-Care Really Matters. And we know how important it is to take care of yourself, especially when you're caring for a loved one. So please visit our education calendar for more information on how to register. This webinar is now concluded.